Walden, a Republican who sits on the Energy and Commerce Committee. Based on what you know so far and the proposals that are out there for Medicare for all, Congressman, we can throw it up on the screen. Comprehensive benefits and freedom of choice, no private insurance premiums, co-pays or deductibles, reducing the cost of prescription drugs, and they say they can do it all in 2 years, Congressman.
Well, we're not Venezuela, and that's what they're talking about doing here is a complete government takeover of your health care. 158 million Americans get their health insurance through their employer or union plans. Those would be gone. Medicare Advantage plans, gone. TRICARE, gone. And they think the government can do it more efficiently and affordably. And yet we know from both liberal and conservative think tanks that the bill is $32 trillion. You'd have to double the corporate and personal income tax and then have your doctors and hospitals take a 40% cut in what they get reimbursed at. So what do you think the wait lines are going to be? We look at single payer systems around the world. There's a woman in Nova Scotia whose video has gone viral, Inez Rutterman, who waited 2 years to get a diagnosis that she had cancer, and by then it was stage 3. She's 33 years old. We know about the wait times. If you think it's fun to wait in line at DMV, you're going to love Bernie Sanders' wait times for Medicare for all, because that's what it's going to be. People are going to wait. We're not going to have innovation in medicine in America, which is where we innovate in the world. And they're doing all this in the smallest hearing room in Washington. That's the Speaker's pocket committee, 5-2, up in the Rules Committee, not the committee that has the policy.
So tell me about that, because we've heard from Nancy Pelosi on this issue herself, dating back to a February Rolling Stone magazine interview in which she said she was personally agnostic on Medicare for all. She openly asked the question, how do you pay for that? So while we showed a bunch of 2020 hopefuls who are in favor of this, Nancy Pelosi seems skeptical.
Remember, she's the one that told the National Association of Counties about Obamacare that Congress had to pass it so we could all find out what was in it. This is her committee. The Rules Committee is appointed by the Speaker of the House. So she has chosen to have the Rules Committee, her own committee, where Democrats outnumber Republicans 5-2. They're the ones doing the hearing. The Energy and Commerce Committee that I chaired under Republican majority in the last 2 years, that's where you got over 50 members, big hearing room, lots of opportunity for the public to participate. That's not where the hearing is. I've asked for a hearing on Medicare for all, and the Democrats won't do it in the committee that has the policy chops and the jurisdiction to do it. They're doing it up in the Rules Committee. This is unprecedented, and it's the wrong way to approach a complete government takeover of our health care system.
So in addition to 2020 hopefuls, and we were showing some images of Alexandria Ocasio-Cortez, the freshman congresswoman there, because this legislation secured the backing of more than 100 congressional co-sponsors, including Alexandria Ocasio-Cortez, Ilhan Omar, Pete Buttigieg, Cory Booker, Kamala Harris, Kirsten Gillibrand, Bernie Sanders, Elizabeth Warren. Some of them have fully endorsed the proposal that is out there. Amy Klobuchar has instead supported only a public option, Congressman.
It's also a great admission, isn't it, on their part, that Obamacare is not working for so many Americans. So what they want to do is double down on that concept and make it all government run. Well, you know, we've got government run systems, and while the VA does help veterans, every member of Congress, I would argue, has 1 or 2 staff people that spend full time trying to get their veterans in their district access to timely care in the VA. That's the kind of system you're going to end up with here, and I think those delays will cost lives, as we know they do in other countries with single-payer systems. So it's a great bumper sticker. It's an expensive solution.
Just as far as what's going to actually happen in this first ever hearing on Medicare for all, Republicans have invited a couple witnesses, including Charles Blehaus. He's from George Mason University. He's a senior researcher there. He plans to answer the question that Nancy Pelosi asked, how do you pay for that? He is suggesting in a study that this would increase government health care spending by over $32 trillion over a 10-year period, lead to historic tax increases. And those tax increases, he says, would only recoup about $2 trillion worth. So we will hear from some of them in that hearing room. But Congressman, I would press you then, what is the Republican solution then?
Oh, I think we've had several. And one is to take some of the models out of states where they come in and my state does this, Maine does this, Maryland does this, buy down high-cost patient costs through reinsurance programs. Those can work if they're designed correctly. I want to go after costs of health care. If I'd remained as chairman, if the Republicans had stayed in the majority, that was our focus, get drug costs down, to find out why hospital costs are so high. Look at every part of this medical industrial complex, because at the end of the day, we're all paying more out of pocket when we go to get our drugs or pay our bills through higher and higher copays and deductibles. And we need to figure out why that system is costing Americans so much and go after the cost drivers, not turn it all over to government, which we know is not the most efficient way to run anything.
All right, Congressman Greg Walden, we all look forward to seeing what comes out of this hearing this morning, happening a short time from now. We appreciate your time ahead of that this morning.